about this practice that brings you so much joy? Why did you decide to help open this?
I decided to open my own practice because working in healthcare for so many years, I saw where there was a need for primary care services, but specifically for direct primary care, where we provide healthcare services in the form of a monthly membership.
Okay, I thought that was a fascinating business model. You decided that this is what you're going to do.
Yes.
Kind of like a gym membership in a way? How does it work?
It's pretty much like your Amazon Prime subscription, Netflix, Hulu,
Subscribe to health.
Subscribe for healthcare services. And so it's a monthly affordable, you're not locked into a contract. But with that, we're able to provide you with unlimited monthly visits, discount on other ancillary services like lab testing, and we also provide care coordination where if you need to see a specialist of some kind, we will help you with that as well.
It's wonderful. One of the groups that you work with veterans.
Yes.
Okay. Tell us about that onboarding process. How can someone that's a vet get help from you?
So with our veterans, we help them with their disability evaluation so that they can receive compensation for any disability. And so basically we go over their claims, whatever they are claiming in regards to their time that they served, and we help them with those claims and reviewing their medical conditions, helping them to gather the evidence and to basically submit that claim so that they can receive compensation.
And speaking of claims, there's other people that often have claims, and that's when somebody's hurt in a car accident.
Yes.
I've been hurt in a couple of car accidents. Have you ever sadly been in one?
Thank God, no.
Okay, good for you. I don't stand so close to me that I don't rub off my bad karma on you. But yeah, one time I couldn't even move my left arm over my head.
Wow, yeah.
I was injured. So in the state of Florida, you have to put together, I guess, a claim within how many days? Like how soon do you have to be?
Yes, so in the state of Florida, you have to receive what's called an emergency medical condition evaluation within 14 days of that auto accident so that you can receive what's called PIP, personal injury protection. And in the state of Florida, you can get up to $10,000 in medical coverage, but you have to have that emergency medical condition evaluation done by a licensed healthcare provider, which is a service we also provide here as well.
You provide a lot of services, and you've also built a network, right?
Yes.
So tell us what somebody could expect to have completed here.
So our general primary care services, so whether you need to be seen if you're sick, if you need a physical, maybe for school or employment, if you need refills on medications, if you're a woman and you need a well-woman exam, we provide all of those services under our direct primary care membership. In addition to, we help the veterans with their medical claims for compensation and workers' comp for if you have an on-the-job injury, and those personal injury evaluations for auto accidents.
What do you love best about what you do? I
just like to help people. I think it brings me joy to help people in their medical needs because, for one, our health is important, and to help them to better themselves and to teach them to be advocates of their own healthcare. That's truly important to me, and that's what brings me joy.
Yeah, head to toe and fingertip to fingertip, right? You only have this one body.
One body,
and
yes.
We're responsible for taking care of it.
Yes.
A lot of times, I know I don't eat really well enough, and I sometimes don't take care of myself either, but it's important to, just get yourself, I guess, to be almost proactive. And by having a membership like you provide, somebody can be proactive about their health.
Yes.
Right?
Absolutely. So, that's one thing we teach people about the membership, and it's, it's not that you wait until you're sick to see your healthcare provider, but being proactive and getting your regular checkups and getting your regular lab testing, being proactive and staying on top of those things so you don't wait until you need to be in the ER or something catastrophic or emergency. And we can't always prevent everything, but we definitely can help you with some solutions to provide in providing primary care.
Now, you're taking your learning and your knowledge. You actually told me that you were able to have, in high school, Like you knew that healthcare was going to be your journey.
Yes, I decided early on that I was going to get into healthcare some way. And I was also inspired by my grandmother, who was a registered nurse. And so just seeing her growing up and also being around a lot of healthcare professionals, you know, being from New York, there's like a doctor's office, a hospital in every corner. My mom worked in the hospital system for over 30 years. So I was around healthcare a lot. And I just truly believe that this was the plan God had for me.
Yeah, family legacy. Good
Yes.
for you to step up to that.
Yes.
You know, it's a great responsibility, but you're also very giving and very generous of spirit because you started a company that's also helping others. What is that? International?
Yes, the International Business Association for Nurses.
Okay.
I started up that organization in 2020, and that just came out of my own journey in starting my own practice, you know, going from healthcare professional, healthcare provider to entrepreneur. And I shared that journey on social media, and I was able to help others, and that just grew. It kind of blew up, really. And we offer a lot of courses, webinars, resources, helping nurse practitioners, nurses, physicians, chiropractors with business resources and starting up their own clinics.
I celebrate you.
Thank you.
You know, February is a special month for some things. March is a special something for something else. You fit all these categories. Amazing. So no matter whether it's January, February, March, April, May, June, July, August, September, October, November, or December, Dr. Chung is where it's at. You are just effervescent. I've really enjoyed talking to you and your energy.
Thank
and the
you.
fact that you're so other-centered. You know, and I love interviewing. I've interviewed a lot of people in my life so far. But when I meet someone like you, and you just kind of like that enthusiasm and that spark, I know that you care so much about the people you help. So it was an honor to be here with you.
Thank you
today.
so much. I appreciate it.
Dr. Chung for inviting me. And stay tuned for more. It was Living It Up. We're having so much fun in Tampa. You should visit here. It's a great place.